When you are at risk of developing a pressure ulcer, it is very important that you have a well-balanced diet and keep yourself hydrated. Your skin requires a good level of nutrition and fluid to help keep healthy. If you are not eating as well, losing weight, or are not eating the right foods, this can increase your risk of developing a pressure ulcer. But what is a well-balanced diet? This is called the Eat Well Guide and shows what a healthy plate should look like. It recommends that a third of our plate should be made up of fruit and vegetables and about 5 portions a day. Another third of our plate should be filled with starchy foods. This includes potatoes, bread, rice and pasta. It is recommended that our whole grain options of these foods are chosen. These contain more fibre. These types of foods are a good source of energy and nutrients. The rest of the plate should include proteins such as meat, fish, eggs, beans, pulses and others, which can include meat substitutes, and dairy or dairy alternatives such as milk, cheese and yogurts. These provide a source of protein, vitamins and calcium. Unsaturated oils and spreads should be used in small quantities. These foods are high in fat, salt and sugar, such as crisps and chocolate and cakes. These should be eaten less often and in small amounts, as they're typically not needed in our diets. However, these foods can provide a good source of energy. Therefore, if you have a poor diet or have recently lost weight without trying to, these foods can temporarily be increased, along with other foods from other sections. If you have a pressure ulcer, your body will be burning more calories than it usually would, as wounds require energy to heal. It's important to be mindful of this and ensure you are getting the right amount of food to provide for it. Protein is especially important for the maintenance of our skin. If you already have an open wound, protein is used by the body to help build and repair tissues, including muscle, bone and the skin. It helps to transport nutrients around the body. As mentioned previously, protein can be found in meat, fish, eggs and all types of beans and pulses and dairy products such as milk, cheese and yogurts. However, there are other good sources of protein to consider. Meat alternatives such as corn or others containing microproteins, nuts, oats and other cereals and protein-rich vegetables, which include broccoli, spinach, peas and potatoes. The amount of protein food contains can be checked by looking at a label on the food packaging. This tin of beans contains 8.7 grams of protein per half a tin. For context, a chicken breast contains about 40 grams of protein and an egg contains 6 grams of protein. Healthy adults will need about 1 gram of protein per kilogram of their body weight. If you are unwell, then have an open wound, this needs to be increased to about 1.5 gram of protein per kilogram of body weight. If you don't know how much you weigh, the average recommendation for protein intake is 45 to 55 grams daily. However, have you been told you are at risk of developing a pressure ulcer, it's likely that you will require more of that. The need for protein varies from person to person. For example, if you're doing a lot of exercise, additional protein will be required to supplement the growth and repair of your muscles. And if you have a pressure ulcer or an open wound, more protein is required for the growth and repair of the tissue involved. If you are not having enough protein in your diet, your skin can become thin and fragile, and wound healing can be slower. Proteins can also maintain skin structure, strength and elasticity. One of the proteins involved for this you may be familiar with is collagen. Vitamin C is needed in your diet to help your body turn the protein into collagen. Therefore, it is essential that you get plenty of vitamin C too. This can be found in a wide range of fruit and vegetables such as oranges and other citrus fruits, broccoli, potatoes and strawberries, blackcurrants and peppers. These are many factors that can cause a reduced appetite. Both physical and mental health can have an impact on this. Some medical conditions and medications can cause nausea and vomiting, and these can put you off eating. If this is the case, have a discussion with your doctor about the medication which can be prescribed to help. Stress and anxiety can cause your hunger to be suppressed. It can be helpful to eat little and often instead of having 3 larger meals during the day. It is also a good idea to fortify your food. To fortify means to make meals more nutritious. This means that eating smaller amounts wouldn't be detrimental as you would be getting more nutrition from them. Food can be fortified by enriching them or adding to them. Some examples of this are using full-fat milk, adding sugar or honey, or fruit to vegetables and condiments or grated cheese to your meals. Adding creams to soups, having sugar with tea or coffee, and having a biscuit with your cuppa. Make sure that your staple items such as butter and yogurts are full fat options and are not low in calorie. Speak to your nurse or health professional as there are leaflets about types of foods to eat that can be provided. If you're already fortifying your diet and you're struggling to maintain weight, then you require additional supplements. Some, such as Complan, can be bought from the supermarket or chemist and can be added to puddings and soups. Supplements can be prescribed. These are usually in the form of a drink, but can also come in a form of a juice, milkshake, shots and a pudding. You'll need to speak to your GP and may require further assessment from a dietitian. There may be other barriers to not getting enough to eat or drink. Swallowing difficulties can be caused by certain medical conditions, such as following a stroke, dementia, and cancer of the mouth or esophagus. This can present as not being able to chew your food properly, coughing or choking and bringing food back up, or noticing a gurgling sound when eating or drinking. If you think this is affecting your speech, your GP, you may be required assessment by the speech and language therapist, who will be able to advise you on swallowing exercises or techniques, or make recommendations on the consistency of food and fluid to make it easier for you to swallow. Dental problems or poor fitting dentures can also make it difficult to chew and swallow your food. Make sure that you're registered with a dentist and have regular consultations, at least once a year. If you're experiencing any difficulties with your teeth or dentures, ensure that you see a dentist sooner. If you're able to get to the dental clinic, speak to your dentist so they can arrange a home visit. Your skin also needs to be well hydrated to stay healthy. You can stay hydrated by drinking 1.5 to 2 litres of fluid per day. This is about 8 glasses of water. Although it doesn't sound much, it can be difficult to get that amount of fluid. It doesn't always have to be water. You can use fruit juice or squash to flavour your water, and hot drinks can be included in that amount. Fizzy drinks and caffeinated drinks can also be fine, although these are in moderation, as too much can irritate the bladder. Try to set yourself reminders to drink throughout the day, for example when you're in an advert on the TV or at a set time during the day. Another good tip is to fill a 1 litre bottle or jug and aim to finish it by lunchtime before refilling it again and aim to finish it before bedtime. Don't worry that drinking too much will make you pass urine at night. Becoming dehydrated can be more harmful as it causes urine to become concentrated, and this can irritate your bladder and cause you to go even more frequently. Food can also provide a valuable source of hydration. 20% of your daily fluid intake comes from food. Fruits and vegetables such as melon, tinned fruit cocktails, salads and broccoli can provide up to 140 ml of fluid, and other foods such as mashed potato, baked beans and eggs are also valuable sources. Ask your nurse or health professional for hydration boosters, leaflets and for some tips.